Hello, welcome to this live State Innovation Exchange Teletown Hall. Thank you so much for joining us today. For those of you who dialed in our inbound participant line, thank you for being on time and engaged. We appreciate you dialing in on that inbound line to join us for this very start of this live Teletown Hall. Hang tight with us for a second while we finish our dial out, and I'll tell you how you can participate today. We're dialing out right now. We'll be finished in just a minute, and when we are finished, I'll turn it over to Tom Letarte, who's the Michigan Director for the State Innovation Exchange, and he'll be introducing our legislators who will be speaking, as well as a panel of public health experts. So we will be hearing from Governor Whitmer as well, and then we'll hear from a panel of public health experts, and then from our three lawmakers who have joined the forum. And while you're listening to them speak, think about questions you'd like to ask for Q&A. We will spend a majority of this live Teletown Hall on Q&A. We've got updates for you and information, of course, so you may grab a pen and paper to write down any important information you hear. But as soon as you have a question you'd like to submit for Q&A, you can do that just by pressing 0 on your phone. So again, press 0 if you'd like to submit a question for Q&A with our public health experts, our three lawmakers, and with Governor Whitmer. Again, press 0 to submit any of those questions at any time. Or you can just tune in. We'll also be running some survey questions related to COVID-19, and we appreciate your feedback on those. We'll be running those a couple of spots in the call, and you'll have the opportunity to vote on those just using your phone. So again, thank you for joining this live Teletown Hall. We appreciate your participation. Stay tuned. Think about questions you'd like to submit for Q&A. As soon as you have a question you want to put in for Q&A, press 0. You'll speak to an operator, give them your question, and then you can either ask your question live or let your operator know if you want me to ask your question for you, and I'm happy to read it over the air instead of bringing you up live to ask it. Whatever is more comfortable for you. Either way, press 0 to submit a question, let your operator know if you want me to read it, and again, we have a panel of public health experts and lawmakers here on the line to answer those questions. So we encourage you to press 0 with any questions at any time, and we're happy to take those after some introductions. So thanks again, everybody, for joining us. Remember to press 0 with any questions. My pleasure to kick this off by turning it over to Tom Letarte, the Michigan Director for the State Innovation Exchange. Go ahead, Tom.
Thank you, and thanks everyone for joining the State Innovation Exchange's Teletown Hall for a conversation about work being done to protect our community's health, our economy, and our democracy during the COVID-19 crisis. My name is Tom Letarte, and I'm the Michigan Director for the State Innovation Exchange. And I'd like to introduce our state lawmaker panelists first, and Governor Gretchen Whitmer, and then we'll have Ian get right to your questions. We also have Carol Osterberry and Dr. Ruta Sharmpani from Wayne County Health Department of Health, Human and Veteran Services, and Steve Gray, the Director for Michigan's Unemployment Agency, and they'll be available to answer questions as well. So first, let's hear some brief remarks from Senator Chang.
Hi, everyone. Thanks so much for joining the call. I'm Stephanie Chang. I'm the state senator for District 1, which includes a large portion of Detroit and a large portion of Downriver.
Great, thank you so much. And now, Representative Tate, would you like to say a few words?
Good afternoon. My name is Joe Tate. I'm a first-term state rep. I cover the lower east side of Detroit into the eastern suburbs of Grosse Pointe Park, Grosse Pointe, and Grosse Pointe Farms. Glad to be here.
Thanks. We're glad you could join us as well. And finally, we have Representative Tyrone Carter.
Hi, good afternoon, everyone, and thank you all for joining us in this important call to address some issues. I represent E-Course, River Rouge, and the city of Detroit, everything from Belle Isle to downtown and everything in between, and just glad to be a part of this.
Thanks so much. And finally, now we'll hear some remarks and an update from our governor, Governor Gretchen Whitmer.
Great. Well, thank you. And thank you, everyone, for making time to be on this call, and special thanks to these phenomenal legislators. You know, we are in the midst of COVID-19 that is spreading across our state. We knew it was a matter of time, not a question of if it would come to Michigan, but a question of when. And unfortunately, we've seen a lot of people get infected by COVID-19, and that's why we've taken some serious and aggressive steps to keep people safe and to make sure that our nurses and our doctors have the ability to try to catch up. The situation with COVID-19 is that it's a novel virus, which means there's no cure, there's no vaccine. It is highly contagious, and it is deadly. And it's really important that we're all doing our part and taking it very seriously. We know that today, as of today, we've lost 417 Michiganders to COVID-19. And this is important for us to remember that every one of these people had a story and has family and loved ones who can't even congregate to mourn because of how deadly this virus is. And that's why executive orders like the ones that I've signed over the last few weeks are so important. The most important one was the Stay Home, Stay Safe executive order. It orders that all non-critical businesses temporarily suspend in-person operations and directs all residents to stay at home unless they're out for essential needs or they're part of the essential workforce. I've signed 2 supplemental budgets that commit $150 million to combat COVID-19. My administration is working around the clock to secure personal protective equipment for our nurses and our doctors and everyone on the front line. Everything from N95 masks that you've probably heard about to gowns and ventilators and hand sanitizer. I extended all April 2020 city and state income tax filing deadlines in Michigan to July 2020 to give people some relief for that impending date. And I've expanded unemployment benefits to workers who've been impacted by COVID-19. Among other things, I've also banned evictions and tax foreclosures as we deal with this crisis and work to make sure people are connected to water. And I signed an executive order that has, requiring the reconnection to residents that had their water shut off. Now, over the weekend, the Michigan Department of Health and Human Services launched a new volunteer website. It's www.michigan.gov/fight COVID-19. That's where trained medical professionals can register to serve their fellow Michiganders by assisting hospitals in fighting COVID-19. State residents can also use the site to find out how they can help in their local communities, whether it's signing up at the Red Cross to donate blood or if it's donating resources or medical supplies. So whether you're a medical professional looking to volunteer or someone who can give blood, everyone can play a role. And for some of us, the role that we play is simply staying home, and that is critical. So I've also called upon Michiganders and businesses to donate items needed most by hospitals and medical providers. The things that we're really in need of most at this time are hospital gowns, ventilators, hand sanitizer, gloves, surgical masks, those N95 and N100 masks that are absolutely critical for our healthcare providers, and no-touch thermometers. So if you are looking to donate something, whether it's your skills or it is some sort of a resource that you're able to, or if it's even bringing a meal to someone who's homebound, there are lots of ways to serve. And as I said, if it's simply staying at home, that really is critical. When we have too few personal protection equipment and we don't have a vaccine or a cure, the best thing we can do is keep this from spreading. And that's why staying home is so important. In the coming days, we're going to have challenges like we've never, ever imagined. It's going to require fortitude and strength and grace. Our frontline healthcare providers are going to need more support. Our sick are going to need beds and care. Our unemployed will need some help, and our businesses will need information. But what I see, even on the hardest days, is I see inspiration in the people of our state. We're strong, smart, and determined people, and we look out for one another. So no matter who you are, where you come from, how you identify, no matter your age or your risk factors, race or socioeconomic status, your health and safety matters, and I will keep fighting for you. When I say we're going to get through this together, I mean it. And now I look forward to answering a few of your questions.
Thank you so much, Governor, and thank you everybody again who's joined us on this live teletown hall. Thanks for all those around Michigan who are joining our live forum with Governor Whitmer, our panel of public health experts, and our lawmakers who have joined us on the line. We'll start taking questions next. So if you do have a question that you'd like to ask, we'd like to take as many as we possibly can from the live audience. So please press 0 on your phone to submit a question for Q&A. We're going to take some questions for Governor Whitmer, who's graciously given us some of her valuable time this afternoon. Then we'll hear from our panel of public health experts, our 3 lawmakers who have joined the forum, and after that we'll take some more of your questions. So again, please just press 0 to submit a question. Also, we'd love you to stick around and vote in our anonymous polling questions related to COVID-19. We appreciate that feedback as well. All right, let's take a few questions for Governor Whitmer. while we've got her on the line, we've got this first one from Nancy in Flat Rock. Go ahead, Nancy. You're live on the line with Governor Whitmer.
Please remember to pray to the Lord. He listens, and He will help us get through this. I know. I say my rosary every morning. God bless Michigan.
And Nancy, did you have a question you wanted to ask of the governor?
Yes. I would like to know, how long does she think this is going to last?
Yeah, thanks, Nancy, and thank you for those kind words. I think in challenging times, our faith is so important, and so I appreciate your prayers, and that's very kind. You know, with regard to how long this is going to last, you're asking the question I think everyone would like to know the answer to, including yours truly. Here's what I know. This virus is incredibly contagious. It's deadly. 2 people in a household can get it, and one will just experience a fever, and the other might be a fatality. There are stories like that around the world, frankly, and that's why it's so important every one of us conducts ourselves as though we are able to transmit COVID-19, and that means do the social distancing, washing your hands, protecting yourself and your loved ones. If everyone did their part and really strictly adhered to the stay-at-home order, only left for real essentials and minimize how many times they left, we could shorten how long we're confronting this crisis. One scientist said that if everyone just froze in place for 14 days, the virus would come sputtering to a halt. We know that if we're not together, it can't go from one person to another. And that's precisely why these aggressive actions are so important. Now, clearly people are going to need to get their pharmaceuticals, or people will need to get food. What we're asking is that everyone minimize how many trips they make and how often they go out of the house. And when they are out, to observe that 6-foot distance and to wash your hands. These are really important measures that everyone needs to take. And if everyone does their part, we will shorten how long we are confronting this crisis of this nature. So it's on all of us to do our part. And those of us who take this seriously, the states that have the most compliance, will see that they will confront this the shortest amount of time. And that's why I can't tell you precisely how long, but I can tell you we're being aggressive, and the more aggressive that we are, the better outcomes in terms of fewer people that will get sick, fewer people that will be fatalities, and shorter period of time that we're in this situation.
Thank you, Governor Whitmer, and thank you for that question. We appreciate you asking that question, and for everybody who's submitting questions right now, thanks so much. We're going to keep going and get through as many as we can in the time we have with you. We've got Pamela in Detroit live next. Pamela, you're up. Go ahead with your question, please.
I have 2 questions. The first question is, since everyone is staying at home and the utility bills are going up higher, why come the utility companies are not giving anyone a break? And the second question is, what is the automobile insurance is doing about giving people a break?
I appreciate the nature of the questions. I think that, we are 3 weeks into this kind of new reality that we are navigating. Some of the initial actions that we've taken have been to help protect consumers, because we know that in times of crisis that sometimes there's unscrupulous people that try to gouge, and so price gouging protections is something we've been working very closely with the Attorney General on. We know that when you don't have a paycheck coming in, it's going to be harder to make your rent or harder to make your house payment, and that's why we've got protections around evictions and foreclosures. We know that our ability to draw down support for the unemployed is dictated by our policy in state, and so I've extended it from 20 weeks to 26 weeks for unemployment, and I did that early on so we could draw more resources into Michigan. With regard to our utilities, we've been having open dialogue to make sure that people don't lose access to electricity and heat and water, and that's something that's really important. We haven't had discussions on the auto insurance piece, and I think that you're raising an important question, and that's something that I'll pursue with the Director of Department of Insurance and Financial Services.
Thank you again, Governor. Really appreciate your answer to that question, and thanks so much for your question, Pamela. Excellent questions coming in right now from all of our speakers, or from all of our participants. Thanks so much. We're going to go back to our list of speakers. We have some public health experts as well as some legislators here on the line. So let's go ahead and go to our first public health expert. We've got from the Wayne County Public Health Department, Carol Osterberry and Dr. Chang. So to share some insights, if you could, on the coronavirus and health and safety precautions that we can all take. Why don't we start with Carol Osterberry, please.
Hi, this is Carol Osterberry, Health Officer for Wayne County Health Department. And again, thank you so much for hosting this town hall meeting and inviting us to speak. We greatly appreciate the opportunity and, like being able to, spread the word about, the continual words about coronavirus. And, as the governor said, when the executive orders have come down, we here in Wayne County and the health department have, taken them very seriously, working with the community, working with residents so that everyone is adhering to them, because it is all about staying home and slowing the spread. Specifically, I can say even, for like our restaurants, they, we got many calls about, well, I'm a business owner. How can I meet these guidelines? You'll meet the intent of the governor's orders, but yet still, keep my restaurant open and not have that dine-in service. So we provided a lot of guidance, and, to be honest, we have not gotten complaints about businesses not following the orders. It's been more, help us understand and help us participate and be part of the solution rather than the problem. In addition to that, then here, just Wayne County, under the Public Health Authority, we even issued 2 additional public health orders, one for the child care, one for the child care businesses and one for the non-child care essential businesses. We've taken having those businesses go a step further and do daily screening procedures and protocols for their employees who are there, so that we aren't having employees come into workplaces who possibly are, exhibiting symptoms of the coronavirus, and possibly, then working when they're not healthy and, spreading the virus further. Again, like we all keep saying, it's stay at home, practice good personal hygiene. Don't spread the disease. If you're sick, stay home, call your doctor. And then additionally here, we also have been working with the state, or with the City of Detroit Health Department. I know many people have probably heard about the additional testing that is being done out there at the state fairgrounds, because it's all about, getting more testing. We've gotten that information out through our commissioners and legislators, and, so that we're supporting having additional testing so that then we can, help people if they do test positive, and what immediate steps they can do, because sometimes people are testing positive before they even really feel all that sick. And so then it's back to that, like we've been saying, the stay home, monitor your, your own personal, health status, take your temperature, and, don't spread the disease anymore. Now with that, I'm going to turn this over to our medical director, Dr. Sharon Pani, for just some additional thoughts on the actual, numbers that we're seeing here in Wayne County.
Thank you, Carol. I am happy to be with everyone here. As Governor Whitmer said, we have seen a lot of cases, and particularly in Wayne County, we have seen a large increase in cases over the last week. We know this is a strain on our healthcare system, so anything that we can do in terms of doing what Carol has said, staying home, making sure that you're washing your hands, covering your nose or mouth when you're coughing or sneezing, don't touch your face as much as possible. All of those things still stand and should be continued. And we, as she said, are working very closely with the city of Detroit to follow up on all of these cases and to help people understand why we recommend these things in terms of staying home and trying to home quarantine when they have had contact with someone who has a positive COVID. But, it is just really important to follow those orders. Thank you.
Thank you, Dr. Shangpani, and thank you again to Ms. Osterberry. Really appreciate you coming in from Wayne County Public Health Department to give us those updates. Let's go ahead and get a quick question in, and then we'll start hearing from our legislators. We've got our next question coming up from Vanessa. Vanessa, you're live on the line. Go ahead with your question, please.
Yes, I would like to know, is it safe for the children to go out in the backyard and play? My backyard is fenced in, but just sitting in the house, I just want to know, can they get out there and play a little bit?
Dr. Shangpani, do you have a good answer for Vanessa?
Yes, absolutely. It is good for them to get out in the backyard and play. Fresh air is definitely good for people, both for your psyche and physical activity is also good, as long as you're not congregating with other children. If you can stay within small groups in your own backyard, I don't see any problem with them going out. I think actually that is a great idea.
Absolutely. Thank you, Doctor. And great question. Thank you, Vanessa. We'll get back to questions in just a moment here. First, let's introduce one of our legislators who's on our panel today. I'm going to hand it over to Representative Tyrone Carter to share a few pointers about state resources and the stay-at-home order. Representative Carter.
Yes, thank you, Carol and Dr. Shangpani, for the information, and to the Governor Whitmer, for participating on the call today. As we're all aware, information around this outbreak is rapidly changing. For the latest information, please visit michigan.gov/coronavirus. michigan.gov/coronavirus. There's also a link at the top of the website labeled Resources that is constantly being updated by the governor and her team, where you'll find the information on health care, unemployment, child care, education, as well as what to do if you're showing symptoms of the virus. You can also find a list of executive orders for the governor has issued so far. Governor Whitmer and the Michigan Department of Health and Human Services announced that DHHS will close its lobbies to visits from the public except for appointments, and will stop requiring residents to visit offices in order to receive state assistance during the COVID-19 outbreak. If you or your family need assistance during this time, please contact DHHS at 855-275-6424. Again, 855-275-6424, between the hours of 8 a.m. and 5 p.m. Last week, the governor issued Executive Order 2020-21, Stay Home, Stay Safe. This order requires many businesses to suspend in-person operations that are not necessary to sustain or protect life. All Michiganders must stay in their homes unless they're part of the critical infrastructure workforce, engaged in outdoor activity, which was just mentioned, or performing tasks necessary to the health and safety of themselves or their family, like going to the hospital, going to the grocery store. Businesses will remain open for in-person work must take aggressive steps to minimize the virus's spread. If you have any questions about the Stay Home, Stay Safe order, please visit michigan.gov/coronavirus. To put this in perspective and emphasize just how important social distancing is at this time, I'll share my own personal story. On March 6th, I attended a celebration with some of my former coworkers from the Sheriff's Department. Out of that celebration, one of the former coworkers has passed away. Another was on a respirator ventilator. I tested positive, and my wife tested negative, but we're still in the same household, so we're practicing social distancing. And the thing that really sat me down was the death of State Representative Isaac Robinson, who's a great friend of mine. I'm District 6. He's District 4. And, we used to say we made a perfect 10. So, part of me is gone. So I need for people to take this serious, to give it the attention that it requires. Stay home, stay safe, stay alive. We can come out on the other side of this in a couple of weeks, and I think we'll be better for it because there's a lot of lessons to be learned. But in the meantime, just follow the governor's general orders. Thanks.
Thank you, Representative Carter. Really appreciate you. Thanks for being on. Thanks for sharing your story. And we'll be hearing from our other representative, Joe Tate, and from State Senator Stephanie Chang in a moment here. But we had a really good question come in from Douglas, and I think it might be a good one for State Senator Chang to answer. So Douglas has the question. He's in Detroit asking, I'm a senior living alone. How can I get some assistance to get groceries so I don't have to go out and risk infection? And that's from Douglas. Senator Chang, do you mind taking that on?
Sure. Thanks so much for that question. Food and access to food is a really, really important thing right now. There are a number of different options. So depending on what your situation is, there's a number of grocery delivery options, depending on where you are. So it kind of depends on your location. But and then there's also a number of locations that are offering pickup. I'll just share my own district, Senate District 1. We have compiled a number of resources into a Senate District 1 resource guide. And so if you go to my website, it's just Senator Stephanie Chang. So Senator Stephanie Chang, CHANG.com, and click on the link to District 1 COVID-19 resources. In that, there's a whole host of options, Focus Hope, Access, the Ford Resource and Engagement Center. They're all doing pickups, but there are also grocery delivery services. So Michigan Muslims, they're doing a free grocery delivery for high-risk individuals. There's a few time banks in our district that are also doing grocery deliveries. And then, of course, there are some, if you've got Shipt or the Meyer app on your phone, those are also some options. So there's a lot of options. I would just say if you could check out the resource guide on my website, there's a lot of good things on there. But if you have additional questions based on your specific location, feel free to reach out to my office and we'll be happy to find a connection for you.
Thank you, Senator. And do you have your office's phone number you could read real quick for us before we move on?
Sure. It's 517-373-7346.
Great. Thank you so much, Senator. And folks, do grab a pen and paper. We'll read some other phone numbers where you can reach out to contact your legislators later in the call. So grab a pen and paper if you'd like to write those down. Thanks again, everybody, for joining us. We'll get back to questions in just a moment here. Next, though, I'd like to bring in State Representative Joe Tate to share some information about resources with us. Representative Tate, please go ahead.
Thanks a lot, Ian. I really appreciate the time being on this afternoon, and want to thank the governor as well for taking time out of her schedule to be on with us today too, as well as my colleagues and other subject matter experts online. Today, this afternoon, I just want to cover briefly, and I'll actually turn it over to Director Grape, who is the director of the Unemployment Insurance Agency for the state of Michigan. But I really want just to touch on some of the work that's being done around unemployment. We know that there were questions earlier in the call around paying your bills, putting food on the table, utilities, rent. Those are important things, and those are things that many Michiganians are grappling with at this point in time. And I think we're grateful for Governor Whitmer's leadership, also leadership that's been shown in the legislature just to ensure that these issues are not only being looked at and conversations around, but solutions around them as well. And I want to just express that these are obviously common issues that are coming to questions that are coming from my constituents, but broadly across the entire state. And know that we are certainly listening. There have been, as the governor mentioned, a number of executive orders there's been a number of ideas and solutions that the legislature has put on the table as well to ensure that people will be able to pay their rent or look at moratoriums. There's been a lot of discussions around that too. But I want to stop there and just make sure that Director Gray has some time to be on the call and also take any questions about his work that he's doing right now with just ensuring that workers in the state of Michigan are receiving their unemployment claims and getting their questions answered and making sure that they're moving through the process. So I will turn it over to Director Gray, Ian, if that's okay.
Absolutely. Yep, so we've got Director Steve Grape of the Michigan Unemployment Insurance Agency. Go ahead, Director Gray.
Thank you. I just want to first of all tell everybody on the line, thank you for your patience. We've had the most dramatic increase in applications for unemployment benefits that we've ever seen. Over the last 2 weeks, over 400,000 new claims were completed and filed. That was more than what we actually completed in all of 2019. About 110 of those thousand of those claims came from Wayne County itself, and so we know the residents here in Wayne County are, particularly impacted by that. So I want to talk just for a second about how to file and talk to some of the people that we know are have some concerns out there. So first and foremost, we're asking people to file online at michigan.gov/UIA. And that is where currently 97% of people are filing. Normally, you could also go into a local office to file, or you could call our phone line to get assistance with filing. Obviously, because of the coronavirus, we're not having people come into the local office. And we do still have our phone line in place, but we've been getting just a huge volume of calls. And, one day we had over 64,000 callers. We just have the lowest staffing levels that we've had, and so we just don't have the volume, the capacity to take as many claims over the phone. And so that we're asking anyone that hasn't filed yet and still needs to file a claim that they go online and file. We want to save those phone lines for people that don't have internet access or are having some other trouble logging in to the internet in order to do. I also want to speak specifically to, as I said, we've had 400,000 claims. The system is working well. The governor has extended the filing deadline. We will be backdating benefits to your last day of work. And so even if you haven't been able to get in and file, you're not going to be penalized for that. So I just want everyone to be assured that you're going to be able to get in, you're going to be able to file, and you're going to get paid. The system behind the scenes is working well. Like I said, we've taken 400,000 claims without a problem. Benefits that were due that went out this week have been going out. And so it's working well. But I know that there's a small group of people out there that are still haven't been able to file, and I want to speak to them directly now. So there's two groups of people. The first group is people that don't have internet access and can, and so they need to be able to call in and file over the phone. So we've extended special Saturday hours for you this Saturday. So between 7 and 2 p.m., between 7 a.m. and 2 p.m., we're only taking people that haven't filed already and need help filing over the phone. So you can call in and get access that way. We're also constantly trying to add additional people to be available on the phones. We now have many of our staff who aren't normally on the phones available on the phones so that we can take more. We're working with the Michigan Works agencies to add an additional 300 or so of their agents that'll be available for that. We're calling in retirees, recent retirees who have experience with the system to be able to get on the phones and help take your calls. But the main thing that we're asking people is if you don't need to use the phones, use online. You can communicate with us online. We have a chat option online where you can chat with an agent. There's also what's called a web notice, so you can write a question if you need help through the online system. The other group is people that they have internet access at home, but they're experiencing some login trouble with our My Login system. And there's a few people that are hanging out there, and I know you're really frustrated. So we're implementing this weekend a new email address that'll be available to those that are having trouble logging in. And that email will pop up when you experience an error logging in, and you'll be able to email us and let us know that there's a problem, and then we'll have agents that will follow up and contact you. We also have been getting a lot of emails from people that are having that login problem. They're also going to be contacted. So sit tight, and people will be in contact with you. Thank
you, Director Gray.
That's what I got right now. Thank you.
Sure thing. And we've actually got a question for you right away. So we've got Alta and Brownston who's asking, I work 2 jobs and I lost one. Am I able to collect employment for that job as I cannot support myself with just the one? That one's from Alta, if you wouldn't mind taking that on, Director.
Yeah, absolutely, Alta. That's a good question. So we have what's called partial unemployment benefits. And so the benefits that you can get partial benefits if you're working part-time, if you're working less than full-time. So it certainly would be worth applying and getting partial benefits. You just have to be careful to report the wages that you do have, and those will impact the amount of benefits that you receive, but it doesn't reduce them dollar for dollar. It's actually 50 cents on the dollar. So you get some advantage from working and also getting unemployment benefits.
Thank you, Director Gray, and thank you for your updates as well. Thanks for your question, Alta. We're going to get our next speaker up before we get back to your questions. We've got State Senator Stephanie Chang here, and I'd love to hear what Senator Chang has to say to our speakers, to our audience here on the line. Go ahead, please, Senator.
Thanks so much, and thanks again, everyone, for being on this really important tele-town hall conversation. I just have 3 sort of quick points that I wanted to make. The first is that, you know, during this time of this pandemic, and even before these cases started hitting Michigan, one of the things that I've been concerned about has been the rise in discrimination and hate towards Asian Americans. And, you know, as an individual who is Asian American, who, you know, is very closely tied with a number of organizations in the Asian American community, we are hearing reports of some really, you know, just hurtful behavior. So far, we haven't heard of any direct violent attacks, but we obviously want to make sure that that does not happen. So I'm just sharing this information with you so that you can make sure that you and your neighbors pass along this information. If you know anyone that has experienced a hate crime, the Attorney General has established a hate crimes unit, and their hotline number is 313-456-0180. And then for other types of discrimination that may not rise to the level of a hate crime, you can call the Michigan Department of Civil Rights at 1-800-482-3604. So that's my first thing. The second thing I want to briefly mention is paid sick leave. This is a really important topic, and you know, as a legislator, even in my very first term in office back in 2015, this was one of the first bills that I introduced, was around ensuring that every single worker in Michigan could access paid sick leave. So the really good news, although there's more work to be done, is that at the federal level, they recently passed, as you probably know, the Families First Coronavirus Response Act that was signed into law on March 18th and goes into effect today, and requires some employers to provide paid sick leave and paid child care leave to employees who meet certain requirements. I won't go into all the details because it does sort of depend on if your company has more than a certain number or less than a certain number, what you're available to get. But we're really excited to see this, and I think that obviously it's very important during this time for folks who either have COVID-19 or are at home now because your childcare or your school is closed, or any of those other reasons related to paid sick leave. So really want to just mention that this is an important issue, and I also recognize that there's more to do here. And obviously, beyond the pandemic, we're going to have to fight hard to make sure that everyone gets paid sick leave, pandemic or not. And then the third thing, because the governor already touched on this, so I'll just really briefly just say one sentence. Water access is so critical. So if you haven't yet, if you have experienced, or if you have a neighbor who has experienced water shutoff, please make sure to contact the Great Lakes Water Authority, or not the Great Lakes, or Wayne Metro, because Wayne Metro will be able to help restore your water service. And so, you know, with the governor's current executive order that came down on Saturday, that will ensure that all of our water providers are doing what they need to do to get people reconnected. But please also be proactive. So Wayne Metro's number is 313-386-9727. Really encourage you to reach out and also to check in on your neighbors if there is someone that has experienced a water shutoff. That's it for me.
Thank you very much. Really appreciate that. And again, everybody, thank you for participating in our live teletown hall. We've heard from all of our featured speakers. Now we're going to spend the rest of this time taking questions from you folks in the audience. So thanks to everybody who's submitting those. We've got this first one coming from Colleen, and it looks like a good one for you, Representative Tate. She's saying, I'm a senior and wondering what is being done to prevent panic buying of goods. I've been told this could last for months. What is happening as we run out of canned goods and toilet paper? Representative Tate, do you mind taking that on for Colleen?
Absolutely.
Representative Tate, we still got you?
Go
ahead.
Yes. That's a great question. You know, this has been, since we've really been in the midst of the COVID-19 response, price gouging has been a huge issue that we've had to deal with. One of the things that has been a focus of effort for our Attorney General has been being able to ensure that price gouging and consumer protection communication has been in place for us and for members in the state of Michigan. Actually, what Director Gray was talking about with the amount of phone calls and into UIA, the same thing has happened in the Attorney General's office in terms of calling in about complaints for price gouging. So the Attorney General has if you are seeing this, the Attorney General has a hotline that's available for price gouging. If you are seeing that, if you have any complaints along those lines. So the consumer complaint line, which is being staffed from 8:30 a.m. to 4:30 p.m., the phone number is 517-335-7599. Also, they have the toll-free number, which is 877-765-8388.
Got it. Thank you very much, Representative Tate, and great question. Appreciate it from Colleen. We're going to run a survey question real quick next, and then we'll get right back to your questions. We've got one coming up from Kimberly, so hang tight. I will be reading all of your questions the rest of the way. We do prefer to take your questions live in these forums, but we want to take as many as we can, so I'll just read them so we can take as many questions as is possible. Our first survey question for you is this. We want to know, what is your biggest concern right now? Press 1 if it's personal or family health and safety. Press 2 if it's access to food. Press 3 if it's paid sick leave or job loss. Press 4 if it's utility shutoffs or evictions. And press 5 if it's losing your small business. Please vote in this poll now. We really appreciate your feedback. Again, we'd like to know, what is your biggest concern right now? Press 1 if it's personal or family health and safety. Press 2 for access to food. Press 3 for paid sick leave or job loss, and press 4 if it's utility shutoffs or evictions. Finally, press 5 if it's losing your small business. Go ahead and vote on that now. Thank you again for your feedback. We're going to take our next question right away. This one comes from Kimberly, and it looks like a good one for you, Representative Carter. She says, for kids in the inner city who don't have access to Wi-Fi and computers, is there any way to help them out so they can continue their remote learning? Some essential workers are struggling with finding childcare right now. Is there any support being offered for people in this situation? Representative Carter, can you address that for Kimberly, please?
Sure. That is a great question, Kimberly, and thank you. I actually reached out. I have the entire E-Course and River Rouge school districts, and I spoke to the superintendent of E-Course today, and he told me that he had 200 Chromebooks that he had available, but that the students didn't have Wi-Fi, so we would essentially be giving them paperweights. So what I'm working on right now, and I reached out to the president of Michigan AT&T and Comcast, and we're going to have a conversation. We're going to compile a list of those, students who need access to the internet, because with school being out, we don't have to give them any extra excuses. I used to be a child, but we need to at least give them the resources for them to be successful. So that is something that we're working on. The order came out today to close the schools for the rest of the year. So understand that we are really working as fast as possible to make sure that everybody's connected, because everybody doesn't have a phone, and you can't do homework on your phone, and everybody doesn't have a hotspot. So we're aware of that. So thank you for the question, and know that we're working on it.
Thank you again, Representative. Again, thank you for the question. Appreciate that, Kimberly. Yeah, go right ahead.
Add a quick thing on there. Yeah, thanks so much, and thanks, Representative Carter. That's really great. I hope that we're able to make some traction there. I did want to just also note that the Lieutenant Governor Garland Gilchrist is also going to be working on securing donations of technology for affected school districts, although you're absolutely right that if you don't have the internet, if you've got that Chromebook, not as useful, but obviously that technology is also really key. And then I also just wanted to remind folks that Comcast and AT&T do have some limited support services for people right now, and there are some extensions of their Internet Essentials program and things like that. So if you have questions about that, feel free to reach out to any of our offices, and we'd be happy to try to help troubleshoot for you.
Thank you, Senator. Thank you again for your question, Kimberly. Great question. Thank you for asking it. Our next one's coming from Patricia, and it looks like a good one for our two representatives from Wayne County Health. The question is, she's been home for 4 weeks and has to go out to help her mom tomorrow and is having anxiety. Can the virus be passed through money? How long can it live on money? So that's a good question. Patricia, Carol Osterbury or Dr. Sharampani, do you have a good answer for her?
Hi, this is Carol. Yes, we have not had any evidence that the virus lives on money. Certainly after you come home, again, it's the good hand washing techniques that you want to practice and wiping down any hard surfaces. But no, there's been nothing about the virus being transmitted on money.
Perfect. Thank you, Carol. Appreciate that. Thank you for your question, Patricia. We're going to go to our next one from Joanne. It looks like a good one for you, Senator Chang. She wants to know what is being done to make sure that prisoners are safe. Can you take that on real quick, please?
Oh, goodness. Yeah, thanks so much. Yeah, we've been spending some time on this as well. Really, really important question. And, we're seeing the number of cases in our state prisons also increase. And so, I've been working with a number of organizations like the American Friends Service Committee, Citizens for Prison Reform, and others who are really trying to advocate to the administration on this issue. I'll say a couple things. The department is doing a few things, which is great, and I definitely appreciate what they've done in terms of temperature checks and some of the things that they've done in terms of a separate quarantine and things like that. But we're also hearing issues with that. So what we are advocating for is a couple of things. One of the things that we're advocating for is early release options for folks who, are not at all a danger to society. They already score incredibly low on risk assessments, and some maybe are there for very technical parole violations where they didn't actually commit a crime. And so though that is obviously one thing of making sure that we're not necessarily keeping people in that really don't need to be there. But then on the other side, of course, we also want to make sure that those who are and who will remain there, that there are proper safety and health precautions there. And so we have a whole list of like a dozen things that we're trying to push for. I do know that the governor obviously has been incredibly busy, and this is one of the things that is on her radar that they are going to be working on. I'm not certain what that timeline looks like, but it is something that a number of us are, as lawmakers, we're hearing from residents who have loved ones inside and are rightfully, very concerned. So we will keep working hard. This is something that I think every day this week and weeks prior we've been working on, and so we'll keep up that fight. So thank you so much for your question.
Yeah, thank you, Joanne, and thank you for the answer, Senator Chang. Our next one's coming from Leslie, and it looks like a good one for Director Gray with the Michigan Unemployment Insurance Agency. So Leslie's question is unemployment open for the self-employed, contract workers, and freelancers? Can you take that one on, Director Gray?
You bet. Yeah, Leslie, that's a big gap area that we were very concerned about, because normally people that are 1099 or self-employed or don't have enough prior wages in their work history don't qualify for unemployment. However, through the CARES Act, our Congress has expanded coverage to include people that are 1099, self-employed, or don't have a significant work history. And so that just passed this last week, and all the states are currently waiting for guidance from the U.S. Department of Labor as to implementing the program. If you've already applied and then been denied because you didn't have enough covered wages, you don't need to do anything. Once we get the guidance from the federal government, we'll be passing along information and be taking new applications on that. And we're hoping that we won't even have to require, if you've already applied, for you to submit any new information. We'll just notify you of your eligibility. So yeah, we're waiting for guidance from the federal government, and as soon as we get that, we'll be rolling that out.
Thank you again. Appreciate that from Director Steve Gray from the Michigan Unemployment Insurance Agency, and of course, thank you for the question, Leslie. We're going to get our next one up right away. This comes from Colleen, and it looks like a good one for our Wayne County Health Representative. She's in Wyandotte asking, how bad is this for pregnant women? Are there any additional precautions they should take? Also, can you clarify as to what counts as essential for vets to stay open? So a few questions there. Do we have one of our representatives from Wayne County Health who can take that on?
Hi, this is Dr. Sharon Pani. I can comment on the pregnant women. Obviously, again, this is a new virus, so we don't have a lot of data. We always consider pregnant women as a special group, particularly in terms of their immune systems not being exactly as they would be if they're not pregnant. So we do consider them somewhat higher risk for coronavirus.
And I'm sorry, this is Carol Osprey. What was the question about the essential, and you kind of trailed off there.
I was on whether or not vets are essential to stay open. So I'm assuming she's talking about veterinary services.
Oh, vets. Oh, veterinarians. Oh, I'm sorry. Yes, the most recent executive order has limited veterinarians or, veterinary services only to emergency cases. So just, not regular appointments, but emergency.
Very good to know. All right, thank you so much. And thank you for that question from Colleen. Excellent question. Thanks for asking it. Now, I think we're going to take a moment here to talk about the census because, of course, yesterday was April 1st, that's Census Day. It's a huge day. We only do that once every 10 years, so the census is really, really important. I'd love Representative Carter to discuss the census real quick before we move on. Representative Carter, do you have your line on mute?
Oh, I had you on mute there. Can you hear me?
I sure
Hello?
can. Yep, go ahead.
Okay, great, thanks. No, yesterday, as we know, was April 1st, which was National Census Day. And, I've got a list of things that we could talk about. But more importantly, 10 years ago in 2010, Detroit was one of the hardest cities to count. We only accounted 64% of Detroiters. So we missed out on millions, possibly billions of dollars. So I enjoy the campaign, but the thing about it is, this virus has attacked us. So the continuing coronavirus pandemic is a reminder why it's never been more critical that every Michigan citizen fills out their census form. One thing that hasn't changed during this crisis is an accurate and complete count is critical to our state's future. Census counts determine federal funding for local communities and essential services and help determine congressional representation. The census count could determine the federal funding Michigan relies on for public health and disaster prevention, including Medicaid, Medicare, and health care statewide. Federal public health grants for emergency services are also based on census counts. These are the resources that will be pivotal to protecting our public health. Census numbers also determine federal funding for police officers and firefighters who keep our communities safe, schools, senior programs, and much more. And it has never been more convenient to fill out your census form. The form only takes 10 minutes, and it can be completed by phone, mail, and for the first time online. We encourage all residents to complete your census form online, phone, or by the form by April 30th. We can always go to www.my2020census.gov or call 844-330-2020. I'll give you that number again, 844-330-2020. If you prefer the traditional routes, you can still fill out the paper questionnaire and return it by mail. The census is 100% confidential and secure. That means your information won't be shared with anyone, no matter how you respond. So, if you find yourself with a few extra minutes, please use the time to do your part and complete the census form. Thank you.
Thank you again, Representative Carter. Yeah, it's very important. Glad we were able to talk about that during this forum. We're going to get another question in real quick next, and it's going to come from Dolores, who's in Detroit, asking, without medication, how do some get well and others die? Can you have the virus more than once? So a couple of good questions for our Wayne County Health Representative. Dr. Sharangpani, can you take that one on?
So the first question is a very difficult question to answer at this time. We just don't have any idea why some people get better and some people get really, really sick and die. We do know that age is probably the biggest risk factor, so those over 65 are at highest risk. And those who are young, particularly children and young adults, will have few symptoms and be very mildly ill. So age, I think, is the biggest risk factor. And then the medical problems, such as heart disease or lung disease, also play into that as well. As for whether you can get it again, this is a new virus. We don't know for sure. But from what we can tell now, people probably won't get the virus, kind of like the flu, won't get the virus in the next, if they've had it now, they won't get it in the next few months, but it depends on if the virus mutates, again, like the flu, over the next year, if they would get it, say, next year. I hope that helps.
Thank you, Dr. Sharangpani. Thank you so much for your time today. It's been very, very, very good to have you on the line answering these medical questions that we've been getting from our listeners on the line. And unfortunately, we've just gotten to the end of our hour. We have so many more good questions in the queue. I wish we had time to take them. But for anybody who feels they didn't get their question answered, you can stay on the line at the end of this forum and leave us a voicemail message. And if you leave your email or phone number, we can try our best to get back to you and answer your questions. So again, you can stay on the line at the end of the forum in just a couple of minutes to leave those voicemail messages and contact information if we need to get back to you. So what I'm going to do next is ask each of our featured legislators to say a few closing words, and I'd also ask them to share the office contact information so that anybody who's in their areas can call back and get any additional information or resources they might need. So we'll go through our legislators one at a time, and if you are looking for another phone number to write down to get some assistance. I'll also be reading all the other phone numbers that we mentioned at the very end of this call. So grab a pen and paper to write that down, and I'll turn it over first to, let's hear from Representative Tyrone Carter first. Go ahead, Representative Carter.
Thank you so much. If you need to reach me, you can reach me right now. The best way is by email, because we're monitoring the emails. We're not in the office. We're working away from home. And you can reach me at Tyrone Carter, my entire name, no spaces, at house.mi.gov. But we are answering the phones as well. Leave us a voicemail, 517-373-0823.
Thank you again, Representative Carter. And Representative Tate.
Yes, thank you. Just to add to what Representative Carter said, my email address is joetate@house.mi.gov. And my office line, which is checked regularly, is 517-373-1776. And thank you so much, and please continue to be safe.
Thank you, Representative Tate. Much appreciated. And finally, I'd love to hear from State Senator Stephanie Chang.
Thanks so much. So again, just thank you so much for being on the call. We hope this was informational, that you got a lot of good resources to share with your family and neighbors. And I just want to also just say, I think that this is a really important time for us to uplift all of our values of compassion and fairness and equity. This is something that obviously affects so many of our communities, and we have to make sure that we're not leaving the most vulnerable behind. So thank you for being on, and please spread the word. If you need to reach us, our office number is 517-373-7346, and our district office number is 313-922-6949. Thanks so much.
Thank you again, Senator Chang, and thank you to all of our speakers. I'll turn it over for some final closing to Tom with the State Innovation Exchange, who hosted this call today, in just a moment. But real quick, I wanted to read a couple of those important numbers that we read earlier in the call. Wayne Metro Water, if you need to get a hold of them, is 313-386-9727. Consumer Complaint Line, 517-335-7599. If you're finding that there are entities out there that are violating any codes or not in compliance, you can make consumer complaints there. And 2020 Census, so important. You can go there at my2020census.gov, or you can call 844-330-2020. Thank you again, everybody. I'll turn it over for a final word from Tom Leonard, Michigan Director for the State Innovation Exchange.
I really appreciate it, Ian. And I'd just like to thank all of our panelists tonight. Thanks to Governor Whitmer, Senator Chang, State Representatives Tate and Carter, our local experts from Wayne County, and our Unemployment Director Grape for joining our conversation. Thanks to everyone listening in and asking great questions. To stay engaged, you can check out www.stateinnovation.org or follow us on Facebook or Twitter. Please stay home, stay safe, take care of yourselves, your neighbors, and have a great night.